Hello, Suzanne Hendery. Welcome to WG Contents Unscripted. It's so nice to have you.
Thank you, Kirsten. So great to be here with you today.
Yeah, we were just reminiscing about all things Nevada, which are near and dear to my heart, and all the love for Lake Tahoe, and all of the stories around Jeremy Renner and his accident, and and reading about it and retelling that story was pretty remarkable. So happy to have you here. Suzanne is the Chief Marketing Officer for Renown Health. If for those of you that are not familiar with Suzanne, so she has agreed to join me for this fun, unscripted conversation where we get to ask her a few questions and learn more about you. Are you ready?
I'm ready.
All right, here we go. All right, first one. What is on your someday I'll do that list?
Well, my husband does a lot of work with ancestry
Oh,
and
very cool.
genetics
Yeah.
and family trees and all of that. So, my father was an orphan in Boston and had a really interesting history. And his mother was one of the first women in the industrial school for girls in Massachusetts, which was a detention center for young women
Okay.
in the 1930s.
Wow.
So I would love to be able to write that story. And I would love for
You have
Matt
to.
Damon and
Yes.
Ben Affleck, because it's a true Boston story
Wow.
of growing up in foster homes, and he worked hard and became a scholar of Asian studies. So he had a really, really interesting life, a
Yeah.
really hard life. So my someday maybe is I'd love to write a book about that.
Well, we know lots of people that can help you write books. You need
Maybe
to,
a writer girl.
yeah, or any, I mean, we have a large network of people. It doesn't even have to be us. It could be someone else, but you really should do that. That's amazing.
Yeah,
And
it
that
would
is
be
very
fun.
cool. Yeah. And so so when you mentioned your husband is in that line of business, is he the one that helped you uncover a lot of this? And
Exactly. Yeah, it
okay.
was very personal for my father, and for a long time he didn't want to talk about it or
Mm-hmm.
rekindle the history or tell us the stories. But my husband kept finding more and more in the ancestry files and newspaper
Mm-hmm.
articles and things like that. So we were able to find his family
Okay.
connections in Boston.
Wow.
Um, and it just put a lot of things into place before he passed away. So it was really great
Yeah.
to have that history.
So where did he end, what did he end up doing? I mean, for a profession or a
He was
career?
a professor of Asian
Oh, you
studies
said
and
okay.
head
So
of
that's
the department at the University of Windsor in Ontario, Canada, for 40 years.
okay.
Um,
Is that where you
so
grew up?
I grew up in Massachusetts.
Okay.
He was brought up in Massachusetts as
Okay.
well. So,
Okay.
yeah, a
Okay.
lot of ties there.
Oh, wow. Well, I really am going to ask you about this next time I see you and see if we've like written an outline or have a title for the book. Because I feel like that could even be a movie too. What a neat
It
story.
would be.
Yeah. All right. Next one. What's a place for you that feels especially you? Anywhere you feel real settled and it's your spot?
Yeah, one of my first jobs was at the Falmouth Chamber of Commerce on Cape Cod,
Okay.
just out of college. And it's a beautiful area right on the coast with beaches, and you can take the ferry and go to Martha's Vineyard or Nantucket.
Mm.
So that salt sea,
Mm-hmm.
marshy, cranberry
Mm-hmm.
bog
Yeah.
area, I just feel is a
Especially
wonderful
you.
place.
Do you
Yeah.
get to, I mean, have you been back recently or often or?
Yeah, every time we're back in Massachusetts, we
Mm-hmm.
try and take a trip down.
Yeah.
But it's a beautiful location.
We got to find out where Ben Affleck and Matt Damon hang out next time you go and just see if you can cross paths with them somewhere, you know? They
Right.
probably don't spend all of their time in that area anymore, but we can wish that. All right. What's a simple pleasure that you really enjoy?
Um, So many simple pleasures. I think life is all
Yeah.
about the little simple pleasures in life. So, I've been married 40 years to a
Okay.
wonderful partner, and he gets up every morning and brews my coffee and puts it in a thermos for me so I could take it to work.
Oh, okay.
Um, so I think that is a simple pleasure that
Yes.
is just so lovely that he gets up and perks that coffee and puts it in a
Yes.
hot thermos, and then I can take it off to work and work through it all day. So that's one of life's simple pleasures
Yes,
for
it
me.
is. Coffee in the morning is essential. So do you take it?
Yes.
How do you make your coffee? Like, do you with cream,
Straight
sugar,
up.
black? Okay.
Black,
Same
straight
thermos
up.
every day. You've got your like creature of your
You got
ritual
it.
and your habits. And does your husband still work or is he heading
He's
out or
retired
okay.
now. So it means even more because he could sleep in,
Yeah.
but he gets up early to make my coffee, which is really so
Yeah.
thoughtful.
How does he fill his retirement days? Is he doing any fun
He
things?
does a lot on ancestry. So he's
So he's
got
still doing
over
that?
30 people's
Yeah.
family trees
Okay.
that he does research on.
Okay.
Um, so he's always finding interesting things and reporting them back to friends and family.
I bet that that's so fascinating because I would imagine that you probably reveal things that you're like that are just so surprising and interesting and things you would just never expect. And then he gets to communicate that back to his friends and family, right?
Exactly. I
Yeah.
think, you
Like,
know,
did you know?
the fact that you do this podcast to talk to people about where they came from
Yeah,
and what's important to them, and there's nothing more important than what you came from and
right.
the people who came before you and the blood that's coursing in your veins, right?
True.
From your
Yeah.
great grandparents and what they went through and their resilience and their strength.
Yeah.
And I think that's really important.
Well, with that, I mean, is there someone that you really looked up to early on in your life? It doesn't have to be
Yes.
family, but just someone that really shaped or someone you looked up to.
Yeah, my grandmother, the woman who adopted my father
Okay.
at a late age, she met him when he was 16 and very ambitious and wanted to go to university and had no money to do so. So she worked as a nurse
Okay.
at a lot of the Massachusetts state hospitals
Okay.
and worked in Massachusetts at one of the city hospitals. And
Okay.
she was a single woman. She very entrepreneurial, worked hard her entire life.
Yeah.
And she put my father through school. Um, and, she owned a nursing home. So she employed me at 12 years old to work in the nursing home
And this
where
is your
I got to
grandma,
hear
not your mom.
my
This your
grandma.
okay. Wow.
Yep.
I mean, that's really impressive during that time to be doing all of those things.
Yeah. So she was a forebearer and she was formidable for sure.
Yeah.
Um, and like you, hearing people's stories,
Yeah.
elderly people in the nursing home who
Mm-hmm.
could talk about the horse and buggy days and
Mm-hmm.
how the town was and uh, that just captured my love for healthcare and
Mm-hmm.
doctors and nurses and patients,
Well, and
and
just
it's been a
caring for other
lifelong,
people, compassion
yeah,
and empathy and all of that. That's amazing. So did that really inspire your moving into healthcare? So that really played a big part.
absolutely.
Because you said so at 12 years old you were working in the nursing home.
Yes. Yeah.
Was that your first
So
job? I suppose.
it
I
was.
mean, that's a very young
It
age
was
for a
my
first
first
job.
paying job, and
Yeah.
yeah, and she was the only one who would hire me at 12. So
Okay.
it worked out great, but I was there during school breaks and,
Yeah.
every time I could help out. And yeah, she wanted me to be a nurse, and
Okay.
I'm unfortunately a little queasy around
Hmm.
some of the nursing things, but the fact that I get to work in a hospital every
Hmm.
day,
Hmm.
she has inspired that.
Yeah, that's neat. So you grew up with her as an influence, grew up in Massachusetts. tell us about your childhood. Like where, like you have siblings, and what are some of the fun things that you love to do as a kid?
Yeah, my mother was a single mom. I'm the oldest girl of two children.
Okay.
And I think, I grew up in the 70s.
Mm-hmm.
There weren't a lot of divorced single moms.
Mm-hmm.
So I was inspired by her. She worked at Foster Grant, the sunglass company,
Hmm.
in Leominster, Massachusetts. So she got up every day. She was a secretary and then became a paralegal in the legal department.
Okay.
Um, and her claim to fame was she got to open all of the mail every day and all the inventions of new
Yeah.
sunglasses.
Yeah.
So the fisherman sunglasses that
Okay.
go flip up for
Yeah.
fishermen and
Yeah.
women,
Yeah.
that came across her desk and she thought it was a great idea with the little clip onto your glasses.
Yeah.
And Foster Grant made a whole lot of money on those
Wow.
fisher glasses.
Yeah.
But she, got up every morning. She always dressed very nicely, had her pantyhose and her
Mm-hmm.
briefcase and her high
Mm-hmm.
heels. And
Mm-hmm.
I often thought, you know what? Someday I want to be the boss.
Yeah. Well, you have grandma and you had mom. You had a lot of really good female boss women in your life. So that is very cool. I love that.
True.
Yeah. And where is you said you're the oldest of two. Where is your sibling? Is your
My
sister, right? You said
It
a
was a brother.
brother.
So he's passed away now. He passed away
Okay.
last year. And my parents have both passed. So from a small nuclear family,
Right.
it's just me now, which is
Yeah.
kind of an odd feeling.
Yeah. So
Um,
where it makes your next generation, you were talking about your kids are in Washington, right?
Correct.
And so what
Washington
are they
State.
doing? School, work? What's life for them like these days?
Yeah, well, our oldest boy is married and he's
Okay.
still in Massachusetts.
Okay.
So he works for an architecture firm there and does great work. And then our
Okay.
youngest is married and they're pregnant with their first baby. We just
Oh,
found out.
congratulations.
So we'll be grandparents, which is very exciting.
Yes.
So
Oh, I love that. I'm not rushing that stage, but I am really looking forward to that stage.
me too.
I'm really, really excited about that. Every time I see a baby, I'm like, I just want to hold that baby. All right, let's see. What's something that you've gotten better at over the years?
I think I've gotten better at not being afraid at
Mm,
work.
yeah.
I remember earlier in my career, I was just always afraid
Hmm.
that I would make a mistake, that I would get fired, that I would, there would be a typo in a brochure and everybody
Hmm.
would get it and it would be expensive to reproduce. And, I
Yeah.
just felt for a lot of my career. I don't know if you felt that way, but
Yeah.
I just felt nervous
Yeah.
and especially in the business that we're in, where
Hmm.
words and
Hmm.
um, every word
Communication and yeah.
matters,
Hmm.
and photography, and just all of those things.
Hmm.
And I have a healthy respect for my supervisors. I always
Hmm.
have.
Hmm.
So I was always nervous in their presence.
Hmm.
Um, so when I look back at my earlier career, I feel like I was just nervous a lot.
Yeah. And
And
so do you
I
think it's
think,
just been time and practice? And
yeah,
I
I
mean, I
think
think
I'm
that
not
comes with
afraid
age.
anymore.
Yeah.
Like I've made a lot of mistakes
Well, and I
and
think
I
when it
will
happens,
continue
when
to
you make a
make
mistake
them.
and it happens, you realize it really doesn't, like, it's so quickly forgotten, right? It's really not as damaging as you think it's going to be.
Correct. And it's always interesting to me when I make mistakes or things don't go right, how do other people handle those situations
Hmm.
with me? And
Hmm.
I've had really great supervisors and
Hmm.
CEOs over the years who are just like, okay, well, what are you going to do about it?
Hmm.
You know,
Yeah. Yeah.
like, how are you going to fix it?
Right.
Um, so
Well, and I
so I
think that,
think looking back on my career, I've gotten better at not being afraid and
yeah.
making more gutsy decisions
Hmm.
and
Well, and
protecting my team.
I love that. And I think that's such a great example too of being surrounded by people that allow you to make a mistake or fail or
Hmm.
whatever. It says a lot about the leaders around you, the team around you, because it can be very different, right? Where a
Hmm.
mistake is really penalized. But I think if you're in an environment where it's okay, you learn that it's okay. So um and with time, because I think we build a tolerance, right? When you make one mistake, that's really, yeah, it really hurts. But if you make 10, well, I've done this before. It's okay. I have a little bit of a tolerance around it. So,
Exactly.
yeah. Well, last question. We're already at 15 minutes. I would love to hear from you. You talked about your kids, and you're going to be a grandma. So really good, fun things going on in your life. But what's bringing you joy these days?
Well, here at work, we're doing a lot with self-scheduling
Okay.
and making the customer experience faster and easier for people to
Mm-hmm.
get the care that they need.
Yeah.
And as a busy mom, being able to
Yeah.
like schedule a pediatrics appointment at 10 o'clock at night when you
Yes.
remember to
Yes.
do so, or being able to text message, cancel, or modify an
Yes.
appointment. So it's been a couple of year effort, and our IT and our medical staff and
Hmm.
everybody has been involved. But we've got almost half of all of our primary care and specialists, you can now make appointments online, which used to be you had to call a call
Hmm.
center, and I oversee
Hmm.
the call center here at Renown. So the fact that if you need a higher level of customer service, you can always talk to a
Hmm.
real human being is important to me
Hmm.
and our organization. But if you just need to cancel an appointment or modify it, that you could just do it via phone
Hmm.
or on your computer. So that's brought me a lot of joy. And as I hear people talk about putting off doctor's appointments
Hmm.
because they don't want to sit on a phone line for 20 minutes at lunchtime,
Hmm.
um, just knowing that they can do it quick and easy and get in with our fantastic providers is bringing me joy.
Well, as it should. I feel like, I mean, do you, going into this, you said you've been doing it for 2 years. Have you realized any of the concerns that you had going into it? Like, I mean, I just think more from like a resourcing capacity, your scheduling. I'm sure there's lots of things you're thinking about. Have any of those come to fruition that have made it more challenging, or have you been surprised by how easy it's been?
Um,
Or maybe not
it
easy,
certainly
but like
has not
easier.
been easy. I think,
Yeah.
for a lot of our physicians, trusting
Yeah.
someone else with your schedule, you know how you feel about your busy
Yeah.
day.
Mm-hmm.
So to give me authority to schedule your
Hmm.
day would be a huge amount of trust, right?
For
That
sure.
I would
Yeah.
say, Kirsten, you don't have to worry about your schedule anymore. I will
Mm-hmm.
book your appointments.
Mm-hmm.
And you're like,
Hmm.
wait,
Hmm.
that's my whole life is my
Yeah.
appointment calendar.
Yeah.
So, what has been wonderful is my colleagues, the CEO of the medical group and our chief IT officer, have we've been the three musketeers in
That's
this
awesome.
effort, and they have worked a lot on the cultural transformation
Hmm.
and the technology. And
Hmm.
it's not as easy as booking a hotel or an airplane flight when you're dealing with privileged
Sure.
patient
Yeah.
information and doctor
Hmm.
schedules. But it's been incredibly rewarding, and I am so appreciative to all the doctors who have
Yeah.
trusted my team to give
Hmm.
up their schedules because we want them to be able to see patients and experience
Sure.
patients
Yeah.
and not worry about,
Yeah.
every 20-minute appointment.
Well, you're doing something that supports the initiative around convenience and access and really the next generation of, patients that are making appointments. I mean, my two kids are in their 20s and they're like, "Why can't I just text? Why can't I text to make this appointment?" I'm like, "Well, maybe someday, but right now you can't." You're going to have to learn how to get into your My Chart, or you're going to have to learn how to pick up the phone and talk to someone. And they're like, "Really? Do I have to?" I'm like, "Right now, yes, you do." So you
That's
guys
what
are
we're
far
trying to
ahead.
be,
Yeah.
easy for that
Yes.
generation.
Yes.
Yeah.
That's great. Well, congratulations on that. I'm sure we'll hear more about it as you continue through all that. Maybe are you planning to share like any case studies or anything about?
Yes,
Oh,
absolutely. Glad to
good.
share with anyone.
All right. Well, sounds good. Well, thank you so much for sharing your time. We both are it's St. Patrick's Day. This won't be published on St. Patrick's Day, obviously, but that's why we're in our green. So happy St.
Yay.
Patty's Day. Enjoy the rest of your day and thank you so much again.
Thank you for the opportunity. Really
You bet.
appreciate you.